My name is Dr. Kyle Murray. I am with Atlas Brain Spine in Upland, California, and we are a NUCCA chiropractic office, which is a specialty of upper cervical chiropractic, and I'm one of the doctors there. What's unique with NUCCA is the use of an anatometer or a spine master. This is a machine that has been made through the NUCCA organization. It is a really awesome tool in measuring out your posture, especially weight bearing, meaning that you're upright, you're standing in gravity. You're measuring out the pelvic tilt, you're measuring out the rotation translation of the pelvis, and then you're also measuring out from C7 the lean of the body left and right. So you're able to get a really good sense then of the actual position of where the atlas is based off of that. Because if you are tilted, right, this whole cascade of events occurs because of that first bone in the neck taking place that is shifted out, causing pressure on the brainstem. And then that causes the what's called an inhibitory center. It's essentially the brakes to the car. And so if that is taken out, you have only gas in your car and you're constantly contracting, right? So you're always squeezing together. So if you can add those brakes back in, you're allowing the body to balance out. And so we're able to measure if that's taking place with that machine. So having something like that to be able to measure, okay, the pelvis is level in specific degrees down to the quarter degree is really, really valuable when it comes to patient care. And so using those tools helps to ensure that if the patient needs a correction, that they're getting a correction, and if they are maintaining their proper alignment, they're holding, that they do not get an adjustment, because then that can cause harm. So if you're adjusting somebody that does not need to be adjusted, if you're adding a force to their neck when they do not need it, then that is going to be causing harm to that patient, that you're adding something into the body that does not need to be there. Versus if, of course, they're out of alignment, we need to get you back to the proper position and do that as fast as possible. And then also something fun that I've started doing recently with one patient is a grip strength test. And so we have just a device that measures grip strength. So you just squeeze it. I'll have him do it before he gets adjusted. And then if he's holding, fantastic, we take that note. And then also afterwards if he gets adjusted. And so just seeing the difference between having a properly functioning nervous system and how that equates immediately to your grip strength. After the first correction, is the left side dramatically increased. And we're talking probably good 15 to 25 pounds increase, which is significant for, especially if you're training, if you're maximizing your performance. Then being able to increase your strength by just getting an adjustment like that much is a game changer.